Let's talk about acne scars. Now, I'm not going to age myself. I've been doing this quite a long time, but we have come a long way in the manner of which we treat them. Now, the first thing you need to know is that all acne scars are not created equal. There are so many different types, which means there's not going to ever be one treatment that's great for everybody. Now, years ago when I started, there were only a few options, but today with the evolving technology and of lasers and energy-based devices and injectables, we really do have quite a few options. And we have several providers here, including my expert, Dr. Yang.
So first we want to make sure the acne is stable so we're not chasing ourselves in circles. Make sure that we're not getting active breakouts. Once that's stable, we can start the treatment, and we start with an evaluation. There are different types of acne scars: boxcar, rolling, ice pick scars, and different types of treatments depending on what type of scar you have.
Some of them are pigmented, have redness in them, and we have lasers to accommodate all this. It's important we do things, I think, in the right order, because a lot of people are confused. They want to try this they saw on TikTok, this they saw on Instagram, and I think the most important thing is to organize the treatments for them. I always find I like to start, again, you said the most important thing, treating the acne. We don't want to chase our tail. All treatments carry cost, they carry risk. And the last thing you want to do is put patients in a tailspin where they're just getting more acne. And a lot of these treatments can stimulate acne.
Yeah.
And then there's pigmentation and inflammation of the face. And at least for me, I like to calm those things down first. And that's usually with either vascular or pigmented lesion lasers.
Myria is great because of the way the energy is delivered. You can deliver higher energy right into the mid-dermis, which is where we want that collagen induction, and it's safer for darker skin types.
And a lot of times we're not just using one technology, we're using a lot of different treatments. I still traditionally have used for decades a type of filler, actually the original biostimulatory filler, silicone. Everyone hears the word silicone and they think of breast implants, or they think of oversized illegal injections in the buttock. But medical grade, what we call micro droplet silicone treatment, is still a gold standard for any type of scar that's indented. And I think when we look at acne scars, we have to look at a road that's been damaged, right? I want to mention one more treatment. I know you use 𝐀𝐜𝐬𝐴 for skin tightening as well. 𝐀𝐜𝐬𝐴 using fractional micro excision of skin for people with really bad, deep, bound down scars. Kind of like we never want to see scars like this anymore, because with the advent of Accutane and lasers that we have, we should really never see acne scars, but we do still see them. And I really do think 𝐀𝐜𝐬𝐴 is one of those devices where you're actually extracting skin. You would take out little excisions, almost take skin from other areas, and I think that's what we could accomplish. So we're in an exciting place with acne scars. Yeah. And unfortunately, acne still plagues people. And once we first treat that, I think, the world is oyster. Kind of like we never want to see scars like this anymore, because with the advent of Accutane and lasers that we have, we should really never see acne scars, but we do still see them. And I really do think 𝐀𝐜𝐬𝐴 is one of those devices where you're actually extracting skin. You would take out little excisions, almost take skin from other areas, and I think that's what we could accomplish. So we're in an exciting place with acne scars. Yeah. And unfortunately, acne still plagues people. And once we first treat that, I think, the world is our oyster.